All right. We are live now on LinkedIn. Hello, everybody. I am Athena Hall. I'm a pediatrician in Seattle, and I created ZNA Health Network so that we can all come together and shift the healthcare system from the inside. So, we're here today to talk about prevention in healthcare, a very important topic. So, I have with me two members of ZNA. We have Anas and Jennifer. Would you like to introduce yourselves?
Jennifer, ladies first.
Oh, thank you. Sorry, there's a little delay on my end. I think it's my audio. But Jennifer Taylor, I've been in healthcare for 20 plus years, helping with strategy, innovation, and really on the next journey is around prevention, and really passionate about this topic just from my experiences personally and within the healthcare system. Thank you for having me.
Thank you, Jennifer. My name is Anas Abedrabo. I am in nursing out of the practice. I started my career as an ICU staff nurse, then moved into the health technology, and I have the passion and the mission to improve the healthcare system whenever I am. Right now, I am in Canada, so I get excited with the Zena mission. I connect with Athena, and this topic it's for sure one of the most important topics to discuss, and it is close to my heart. So try to find a way how we can work together and find a recommendation more than just blaming the system.
Wonderful. Yes. Yeah, in Xena, we're all about looking at the solutions that are already out there and how we can build on those and scale them out instead of circling around the problems. But it is important to acknowledge the problems in our healthcare system for us to take those steps forward. So, our healthcare system is really built around a disease model and looking at fighting disease. We're all about going to war with disease, using medications and surgeries, and all of that is important once you get to that crisis management place. But what about preventing them in the first place? That's not something that we've invested a lot of time or money into in our healthcare system. So I'm curious what your thoughts are on that, Jennifer or Anas.
Well, I definitely am passionate about this topic, and I've been reading up even recently on some different quotes, and what really resonates with me is creating conditions where illness becomes the exception. So it was exactly what you were saying. How do we get ahead of this? This shouldn't be just our day-to-day. We need to do something differently. So that's really what, from your introduction, what came up for me. And with that, there's so many areas that we can discuss today.
Yeah, absolutely, Jennifer. I do agree with that. So I believe prevention it's not only the government responsibility; it's everyone responsibility. As also as a community, we need to be educated and to make this as a lifestyle of us, taking consideration in our food, in our exercise, all of those things, along with different player they are working together. So it is everyone responsibility, and there is some changes or slightly changes could be happen in our life will make a huge difference in our future.
Absolutely. I love what you said, Anas, about it being a community responsibility. It's really something that's more of a collective responsibility that we need to be supporting each other and creating environments where disease is less common and we're not seeing so much of the epidemics of obesity and diabetes and things like that. And that takes the healthcare system really partnering with their communities and partnering with other sectors like the food industry and our education system so that people understand how to stay healthy, and it's convenient. It's part of the culture. It's part of our everyday lives. So currently we treat prevention like an individual problem, and we tell each individual how to eat better and to exercise. And that's a really difficult thing for somebody in our current society where there's food deserts and there's so much fast food everywhere, and many people can't afford healthy foods. In addition to not having safe places to exercise or having access to community exercise programs. So it really is that collective effort. So thank you.
Absolutely. And here I would like also to add, also the system itself also is not helping the patient or the individual, let's say, before they become patient. So if I want to go for nutritionist or to have a nutrition consultant and to know what is the best food for me, and even if I've been diagnosed, for example, in early stage as a cancer, so the food can cure me in somehow. So that, for example, if I want to go for such as a consultation to know how to plan, how to exercise, or to sit with the exercise coach, this is not covered by insurance. So the insurance will cover this if I am a patient. So they pay only for the diagnosis for the issue and the problem. So to be proactive, even if I am aware about that, I want to do that, the system is not serving me to do that. So I need to pay that from my pocket. And knowing that it's too expensive when you want to go there. So even as I mentioned, not everyone have the possibility to go with the healthy food because all healthy food is expensive.
Yeah, I think what that really brings me into and what we've discussed before is around menu expansion, right, for prevention. So right now we know that, screening, early detection, things like that are on the menu, but why it doesn't include affordable nutrition, having access to that close at hand in the community, exercise programs, just different things that need to be covered, affordable and accessible for all.
Yes, absolutely. Yeah, I love what you said, the menu of prevention. And yeah, and to your point, Anas, we need these integrated healthcare teams with nutritionists and social workers who are offering these sort of services for people. So instead of just seeing a doctor and then making an appointment to see a nutritionist, perhaps out of pocket, and having all these separate appointments, we could have teams that are there to really support the whole health of that individual.
Absolutely, yes.
And there's definitely pockets across the U.S. where they're starting to get into that integrative model, right? But we need more and more of that. It shouldn't just be, sporadic and in certain spots throughout the U.S. It should be everywhere. I really, that integrative approach is important for mental health, for anything, right?
Absolutely. Yeah, mental health is vital for the rest of our health. It determines all the decisions that you make in your life, including how you eat, whether or not you see a doctor for certain things, the state of your relationships. And so, if we're not caring for our mental health, we're really putting out fires and dealing with things at such a late stage. And so, it's something that is truly important for us to be investing in our healthcare if we want to prevent disease.
Yeah,
Yeah.
absolutely. I see that and agree. I'm one of the advocate for wellness and also maintain our mental status. But all of us, we agree that it's very important. And this is also reflects in our lifetime expectancy and also will help us with more productivity. And we know all those biological, it's proven now by science, all those biological diseases came from psychological root, so like depression and anxiety. But when what's coming in reality, still there is hesitant or skeptical to go for the seeking support. And again, one of those challenges also, this is something is considered, it's, I don't know how it's in to be us sure in the US, because different every state they have different legislation. But most of, probably based on my information, where this is not covered by the insurance, and this is somehow considered still luxury, and you need to take this by your own. And there is misconceptual, so go and see one motivational speech or have meditation and it solves, was not.
Yeah, for sure. It goes so much deeper than just those small interventions. It really requires, you know, it requires looking at it from multiple sides. For mental health, it's talk therapy as well as community support. There's so many people improve in their mental health when they know that they're not alone in what they're struggling in, and they feel like they're supported in their community to grow and to shift out of their anxiety state or whatever it is that they're struggling with, so that they can live a healthier and happier life. So, yeah.
And I think that's an important statement because right now the system looks at individual episodically, right? They're not on this continuous journey with them, and you have different life events that come up and that could impact your mental health at different points in your life, as well as other things that come up. And when you have a team that's on that journey with you and knows you, there's more trust, there's healing that can happen. Time efficiency in the sense of, because we know you, right? Instead of now I have to get to know you again, what happened before, taking, all that information back in again, and just that frustration of the cycle. So I really feel like right now, looking at the system, the episodic care is hurting us in so many ways, where prevention can really help us, and looking at the whole human, right? Whole experience and their journey through life.
Yes. Yeah, looking at the whole experience, and life is messy. There's lots of things that come up at different times, and our healthcare system needs to be able to support humans' messy lives as things are coming up, and to have those investments in place, and really care for people on the front end, as well as when crises hit. So, yeah, and one example of a really great system that invests in prevention is the NUCA system of care in Alaska. That one is owned by the Alaska Natives, and they see their community as part owners in their healthcare system, and they actually call them customer owners. They have interdisciplinary care teams that see each patient at each visit, and their visits are an hour long, so that they can really take the time to understand what's going on in that person's life and to address whatever needs are coming up for them. So, and they've seen massive drops in ER visits and significant improvement in mental health. So across the board, they've just seen improvements in the health of that community. And while it seems daunting to make those investments in the short run, all of the money that you have to pour into prevention, I think, is one of the barriers to why we haven't gone there in our healthcare system. But those really pay off in the end. In the long run, we'll see so much fewer ER visits and need for medications. So it's totally worth the investment.
I agree. And there's a research that actually talks or speaks to that more, right? And highlights even the cost savings, if that's really what you're looking at. I feel like there's more to it than just, it creates a community and a trust system and, longevity. But there is research that says, each dollar spent, you can definitely exponentially receive the return. I think when you brought up the barrier piece, it's an important thing, because why aren't we doing it now, right? Why is it so hard, or seems like it's so hard to get there? And I feel like it's kind of complex. Right now, it's, I would say reactive mode medicine, and and very episodic. So that's a huge shift to get into prevention, right? Culturally, structurally, policy related, payment system, all the different components. It's doable, but I feel like we need to look at those systems, look at the barriers, and really start breaking that down, because there's so much in here that will is the right thing to do for our community and across the board.
Absolutely. Yeah, that was really well put. I think in order to shift over into that, we need to really shift the entire foundation of our healthcare system, because it's currently built around making profits, and it's built around the industry rather than the people that we're serving. And so I think for us to really make that shift into prevention, we need to dig up our foundation and really put our patients and the people we're caring for at the center of everything that we're doing, listening to them, asking them what they need, and following through on the services that we say that we'll provide.
Yeah, absolutely. And here, for sure, the financial model overall, we not taking care for the patient as the how we're supposed to do that. And the patient, we keep saying we need to make the patient centric, but it's not. But also, let's step back and take it as a normal person. Like I am not as a profession, so we used to know or to have at least for a long time. I will not visit the doctor unless I have issue. So this is the momentum, or this is the image in the community and society. I will not go until I have something to complain from. And also in the schools as a all healthcare profession and like doctors, we treat them or we educate them to know how to treat the disease, really to educate them how to proactive and giving them that a time to think how to educate the community and give them that concept. So we try to find the disease and with the cure for the disease. And at the same time, when we go and we keep complaining from the shortage, we thought this is shortage issue. For example, it's only for workforce management and not related for anything. But then the reality, the quality has dropped. So if I visit the patient and sorry, if I visit the the physician expecting from me to come and have one issue. For example, here in Canada, the family doctor requests from everyone to come with one issue. So how come I, as a patient, I come and just complain one issue, and the second time, if I want to come and visit the doctor after 3 months, so there is a loss of opportunity to improve and to enhance the system, and also to be proactive. So the system overall, it's need to see it as a holistic view, and sometimes we need to start it from school until we get for what we are trying to do right now.
Yeah, it really needs to start in our schools, in our training for our healthcare workers. Did you have something to say, Jennifer?
Yeah, I was just going to add, it brings up many great points. One is, even with the screenings and the way prevention is provided right now, early detection screenings, there's a low rate right now of usage. So it is busy lives, as well as you don't want to go until you have that one big thing, right? It's taking time. It seems like a hassle because we're going to them, and it's just it takes time out of your day, or you have to get your kid out of school and then plan for all this. It's like a half-day event. It shouldn't be that hard. There should be more of a community feel to it, and getting ahead of that. The second piece that came up for me is, yes, I agree with the medical school education, nursing, all of that, to get ahead of it and start thinking, because you're an example, right? You're an example to the person in front of you. And if you don't have that knowledge, a lot of times that's a lost opportunity, like you were mentioning. I also feel like in our school system, we need to start them early. So getting ahead of this is important, because we're seeing it, in our children now. and seeing the devastation of disease coming up more and more and being a little bit more normal than what we're used to. And this is not the way we want to keep growing and have our future, world impacted by this. So I feel like there's twofold education across the board in all the different areas, and getting ahead of it is going to be important.
Absolutely. Education is really vital for prevention. For our communities to be healthy, they need to understand how to be healthy. And that education piece can come through like healthcare coaches, as well as in our education system from a young age, and in public health outreaches, community outreach programs, where it's integrated into our culture and way of life. And we've seen that in models like in Finland, where they've really drastically dropped the number of people with cardiac disease by working with the food industries and tobacco industry, as well as with the community on education, and really bringing it to people. And that really empowers people to make those healthy choices. So.
One
And I
also,
think, oh, go ahead. Sorry.
one also with the good story to tell and to see it as a role model. There's an initiative and experience in Japan where they make early screening for for the mother during her pregnancy, and they will make sure that there is no any possibility for common diseases for the pediatric, and that in decrease a lot drastically the mortality rate in Japan. So comparing, I cannot recall the number, but there is a huge improvement over 1 decade of the mortality rate happen in Japan. So this is where the screening have a lot of opportunity, and that was not optional. That was part from the mother follow-up visits. So this is where we can also see we have proven that due, as you mentioned, in diabetic management and diabetic disease, and also with the tobacco management, so our cessation. So right now also this is something to share with the pediatrics. So it's been proven in different country there is a good investment there. The challenge here, the result you cannot see it immediately, like what we try to do with we managing the disease. This is needs some time to see the result, and maybe from government perspective, so this is need more time to see the outcome, and sometimes it's not easy to measure those return of investment. But overall, as Jennifer mentioned, there is a studies where $1 invest in prevention, they are saying 4 and more will be in return for this investment, which is a huge ROI.
No, that's great. What I was going to say was just some of the examples, going back to just that concept of you are the example as a physician. It's even showing up in the school system and in our hospitals. What nutrition are we providing them, right? Because this is an example. If we're saying it's acceptable to have just chips for lunch or whatever it is, right? Or French fries, and that's a, healthy nutrition, that's just not sending the right message. I feel like there, of course, needs to be choice, but it needs to be educated choice, and they need to be able to lean into healthier options and get that palate going for their future. Whether you're in a hospital, inpatient, or visiting, right, the cafeteria, as well as in our education system.
Yeah, that's a great point. I definitely see when I'm working in the hospital some interesting food options for patients, and I think it's just it's something that we just overlook in our school systems and in our hospitals, so that we can give people what they want, I guess, instead of really working with them to have those healthy options and to provide that education that takes a little bit more work and money on the front end. So
I've
yeah.
seen some great examples of where they brought in even farmers markets and just different things to help with education and just showing how it's accessible and trying to make the affordable piece too, right? Because sometimes farmers markets can be expensive, but giving, providing that community feel and some education just by displaying that. And then also in their cafeterias having different messaging, not just what's in it, you know what I mean, the labels, but actually, did you know, just little tips and tricks and different things to kind of tear them towards, some better options or, some choices, right? To make them think.
Yeah, and there's a really incredible hospital, I believe it's in Boston, with a garden on the roof, and it helps with the energy in the hospital, not dissipating too much heat in the winter and keeping it cooler in the summer, as well as having a garden that the patients can visit and that they know all of the food in that hospital is, a lot of the food, fruits and vegetables is actually from the rooftop garden. And that's just a really cool example of what's possible. I think sometimes we get so limited in our thinking of what we can do in healthcare and what it could look like. But it could look like rooftop gardens. We could have really massive changes. To your point earlier, Jennifer, of having people come in to see us and miss school, missing work, in order to see that doctor for that one problem that has been, building. We could have community health workers coming to people's homes, somebody that is a trusted community member that is invested in the health of that community, who comes to your home and visits you, checks your blood pressure, asks you about your mental health, sees, is there any needs that we need to discuss that need to be addressed. And that coming to other people's homes or having clinics in the schools or in community centers, making it so much more accessible to those communities rather than forcing them to come see us and have to miss school and things like that, I think would be a huge improvement.
100%.
Athena here, speaking on the school and back for the school, I would like to see from your perspective as a pediatrician. So we started to see the DM started to get more and more with the kids, and they started with 10 years old. When I see DM as a type 2, so it's not type 1. So we keep treat them and give them a treat with the candy and all those rush of sugar, and we give them in the school and everywhere. So I think one of the things we can consider also to educate the healthcare system for the kids, because if they start to get diabetes when they are 10, they start struggling very early on their life with something. Is along with the cost, they will add it on the healthcare system and also in the family, and the life experience for those kids is not good. So this is what reflect also in their mental health and their lifestyle. So I think something as a trick, tips, small things will add a huge change in the future. But right now it's become alarming for everyone to see how the kids they are consuming the sugar right now.
Absolutely. They see that for children from a young age, if they are having really unhealthy diets, that they're already forming plaque in their arteries. They're already heading towards cardiac disease. And so from a young age, they're having diabetes with kidney disease as well as heart disease. And this is a huge burden on our healthcare system, as well as on that individual and their family and their community. And so it really is a community responsibility for us to educate our children to make their environments healthy, to make sure that they have these healthy options, so that they can live healthier lives and have those choices moving forward.
Yeah, and I think, just adding on to the childhood experience and hopefully giving them the right infrastructure and support for growth and longevity, it also gets into safety and environment and housing. So there's so much around prevention that I think we've been talking about nutrition education, so important, but then their environment as well can be toxic or stressful. There's so many different components of it, right? Or not affordable, so they're moving around a lot, or just whatever it may be. And that creates fractures in their state. The way I look at it, I'm an engineer, so I think about foundational things mentally, physically, and then creating fractures in them from different environmental impact.
Yeah, absolutely. We've seen with the ACEs, the adverse childhood events, from a young age, when kids are having these disruptive things in their lives, like having to move away from all of their friends, or having unstable housing, being homeless at some point, being exposed to abuse. All of these things affect your long-term health. And we see so many more diseases in that person as an adult because of or linked to these adverse childhood events. And so that's a huge part of prevention, investing in stable housing for people. And we don't think of that in healthcare. Like, why would we, bother with dealing with all of that? Isn't that somebody else's problem? No, it's so important to people's health, having that safety and having a clean home, and being in an environment that supports their health is so important.
It skipped to my mind, Jennifer, right now for the first time when we are mentioning the housing and mentioning engineering. So for the role of social determination, and I know the engineering, they take care for every details, and they try to make architect and the structure which best for when they build the housing or the building. So have you ever came across some requirement to be consider, like ventilation, lighting, and the side effects on the health? Is this is part from the common practice as engineering they are do, or just considering the building and the structure, how it should be safe when they are building?
Well, I think what comes up for me around that is, really what materials are they putting into it, and are there VOCs, other toxicities that you're introducing into the structure, and are you setting them up for success with, is it a 2x4 or 2x8? Are they skipping out and, trying to minimize the material because of cost, and then that's impacting, because now mold or water or other things can come into their environment. So from a structural standpoint, housing and environment's important, and then you get into water, right, and pipes and everything else. So there's many different factors that come up around, house structure, safety, and environment.
Yeah, I spent about a year on a Navajo reservation after residency during a global health fellowship. And I saw there, a lot of people living in remote areas, and they didn't have access to water, electricity, and a lot of times they would cook things in their home and be exposed to fumes from that. And it was absolutely something that we talked about in clinic there, because it was impacting people's health. Like, how do we get clean water to them? But it was very challenging because with, the uranium mines, they actually had a lot of uranium in their drinking water, and that led to kidney disease, as well as, potentially other really concerning health issues. And I think what happens a lot in our country, and a lot of other places is people that are marginalized, living in these marginalized communities, Native Americans, Black communities, they have the least access to like resources. They tend to live in these food deserts and have really poor home environments that can lead to significant health issues later. And unfortunately, I think that's how our systems are built, is to keep those marginalized communities in those poor living environments and keep them in poverty. And so I think it really takes us recognizing that and really advocating for people, working together to make sure that those needs are addressed and people are having the opportunity to live healthier lives and to come out of poverty.
Definitely. Just adding to that, when I think of, city versus rural areas, the environment can definitely impact different things, such as, if you live near a farm area or a power plant, or, there's so many different factors. So depending on where those communities are, there could be other things that are inundating them and impacting their health.
Yes, absolutely. Okay, well, looks like we are at time. This has been such a great conversation with you two. I've really loved digging into prevention and understanding what that could look like, reimagining our healthcare system as one that really supports health and sees our communities healthy and thriving. I think it's really exciting. And yeah, if anybody has any interest in joining us in ZNA and working on projects together to shift the foundation of our healthcare system so that we can support our communities to be truly healthy, then reach out to me and we'll get you in the community. So, Anas,
I echo your statement, Athena, and I recommend everyone to connect with you. Like what I did, there is a lot of opportunity to make a change and put your fingerprint and live your principle and value and see the change in the future.
I agree, and it takes a community, right? So that's why we're in this together and trying to make, some headway. And there's different things that I'm excited about that we're already, evolving and discussing. So jump on board with us, and yes, reach out to Athena.
Yes, awesome. Well, thank you guys so much. And I hope everyone has a really wonderful rest of your day today.
Thank you.
Thank you.
Have a good day. Bye-bye.
Bye-bye.